Hello and welcome to The Vaccine. I'm Jeremy Fernandez. As lockdowns and restrictions continue easing and we look towards borders reopening, could some communities be bracing for a new wave of infection? In this program, we focus on Indigenous Australians, less than half of whom are fully vaccinated. The ABC's Indigenous Affairs editor, Bridget Brennan, is with me. Bridget.
Jeremy, Indigenous communities are some of the most vulnerable people in this country, and there are real concerns among Aboriginal health workers about what's to come if there are future outbreaks. Coming up, we're going to hear from frontline First Nations health workers to hear about their concerns.
Well, let's break down the areas where those rates of vaccination are most concerning. Casey Briggs joins us. Casey.
Hi, Jeremy. Yeah, let's look at the gap in vaccination coverage between Indigenous Australians and the national average. If we look at the 15 plus population, these figures are from earlier in the week, so the data does line up, but 84.4% of the 15 plus national population have had their first dose of a COVID vaccine. If we look at the 15 plus Indigenous population, we're only at 59%. So that is more than a 25 percentage point gap. And frustratingly, that gap is not really shrinking at the moment. If anything, it's actually going the wrong way. The vaccination coverage of Indigenous Australians looked a lot more like the national average earlier in the rollout, but we're still consistently seeing a first dose gap of more than 25 percentage points, a second dose gap at the moment of 23 percentage points. These are national averages and it varies across the states and territories. Let's look at the state breakdown. This is Western Australia, which has the biggest gap in vaccination coverage, 36.6 percentage points between Indigenous and the general population average. Big gaps as well in South Australia and in Queensland, 26.9%. The smaller gaps are in the Northern Territory, New South Wales, Victoria and the ACT, and all of those jurisdictions look to be slowly closing that gap, but it is pretty slow going. Let's dig down another level again and look at some of the regions of particular concern, and it's Perth that is top of the list here. Mandurah, 39.3% gap. Perth, eastern suburbs, 36%. And then it's also Cairns, a 35.3 percentage point gap between Indigenous Australians and the region average. And that region also does include, the Cairns region includes the township of Yarrabah, which is a relatively large community that is overwhelmingly an Indigenous Shire, an Indigenous population. Some big gaps. You can see a lot of areas with a 30 percentage point gap or more, mostly across WA and Queensland. And if you look at the other end, where are the smallest gaps, these are still real gaps of, up to about 10 percentage points. But the silver lining is at least the regions where the virus currently is, the hotspots, have smaller gaps than the rest of the country. Melbourne, parts of metropolitan Sydney, we've got the ACT in there as well. You can see the gaps there do start to shrink. So at least where there is a lot of virus circulating at the moment, those gaps are smaller, but there's still clearly some work to be done. And then the challenge for the states that don't currently have COVID, well, they will at some point. And so the real challenge is to close these very big gaps very, very quickly, because the virus by Christmas in many of these states, like Queensland and Tasmania, will be circulating in the communities. And just one more note of caution, Jeremy, we've seen through this outbreak and through the vaccine rollout that some small communities can really easily get missed out, like the Wilcannia outbreak, which was left behind. These are regional averages we're talking about. There may well be some smaller communities where there are more significant gaps and more significant problems that we just don't know about because the data isn't being reported.
Casey, thank you. So, Bridget, you're in Melbourne. Lockdown is now officially over there. A lot of people are understandably celebrating, but this gap we've just been hearing about raises some very particular concerns for some Aboriginal and Torres Strait Islander communities, doesn't it?
It really does, Jez, because we know the load of different diseases and illnesses within the community in the Aboriginal population in Victoria is really concerning. And there is still a large number of the population here which is exposed basically as the state opens up. I mean, look, there will be different views because there are Indigenous Victorians who've been in lockdown, in a very, very difficult lockdown for a long time through 2020 and now this year, who'll be really celebrating and who've been fully vaccinated vaccinated for a long time. But then there are those who are still hesitant, still wondering about whether or not they should be vaccinated. There are Indigenous health organisations really trying to bridge those gaps in regional and in urban communities. And we have people who are currently infected with COVID in Mildura and Gippsland and Melbourne. So that's a concern also for Indigenous health workers. I spoke with Corinda Taylor. She's the CEO of First Peoples Health and Wellbeing in Melbourne. And I asked her about how people are feeling now that the state is about to open up.
I think, it's great to have a roadmap, and that's what people ask for. Give us some sort of light at the end of the tunnel, give us something to work towards. And, I know, in the broader community, there's been quite excitement that, today we've hit the 70%. But the reality is in the Aboriginal community, double vaxxed is still sitting around 49%. So for us, it's not a key milestone. In fact, all it does is once again, along with most of the, national KPIs and the closing the gap sort of strategy aims to address, we find that we are disproportionately behind the 8 ball on that percentage. And so while we've got 70% broadly across Victoria, for some population groups, we don't have that. And I think that is a real worry for communities.
And Corinda, obviously a lot of our mob are in urban areas. What are some of the particular considerations for you when it comes to vaccinating people in the cities?
The majority of Aboriginal people living in Melbourne, aren't traditional owners of the area, and, you can live a suburb away and not know mob up the road. So I think that the messaging just needs to be different. And in terms of, local elders and, obviously it would go to traditional owner groups for that sort of messaging. But I think that for different people living across Melbourne, you can be suburbs away and who you want to hear that messaging from can be quite different. So I think that's a challenge in itself. I think people also think that, it's not far to travel across Melbourne. We've got good infrastructure around public transport, and, the pandemic with the lockdowns, particularly Metro Melbourne, has brought a whole different element to the challenges, for trying to get community engaged.
Yeah, and for your workforce, what are some of the considerations? Because it's been a pretty punishing couple of years.
We've, throughout all of the lockdowns, and again in Metro Melbourne, we've asked our staff who are part of the community, have the same worries, take their work home. They're fatigued and they're exhausted, and we just keep asking them to dig deeper, and they do an extraordinary job. But the reality is that, the resourcing, and while there has been some COVID injection funding, there's never enough resourcing to support, the genuine nature of the work and the complexity of the work of our community groups. And so we're stretched thin, our staff are exhausted, and we need them just to keep digging that little bit deeper over and over again without that additional funding to support that work. The chronic disease around the Close the Gap work, none of that's gone away. And in fact, it's magnified, I think.
So that's Wamba Corinda Taylor there from First Peoples Health and Wellbeing. Jeremy, really talking about some of the concerns for urban communities. And those same concerns are reflected in remote communities as well. The Northern Territory has some of the lowest vaccination rates in the country. And as Eleni Roussos reports, the situation is particularly concerning in Central Australia.
I'm here in the Central Australian community of Santa Teresa, about 80 kilometres southeast of Alice Springs. About 600 people live in this community, making it one of the largest Indigenous communities in Central Australia. The Central Land Council has been hosting this pop-up barbecue in the desert. It's all about encouraging people to come out, come together, talk about coronavirus, and to encourage people to get vaccinated. There's also this information session, and it's encouraging people to come and talk about their concerns. And the local Catholic priest has made it down, and he's here to share his own family's experience with COVID-19 in the Philippines, encouraging people to get vaccinated.
My mom stayed for 11 days at the hospital, and she was really terrible. She can hardly breathe.
About 54% of people over 16 have had one COVID dose, and about 34% are fully vaccinated. The problem has been a mix of hesitancy, fear and misinformation on social media.
We won't get COVID because we're Indigenous people. That's for white people. That's what most people are saying. That's what I heard. But diseases are for everybody.
On top of running a busy clinic, health staff have been working around the clock to encourage people to get vaccinated for COVID-19, but it hasn't been easy. This clinic lost 3 staff at the beginning of the pandemic, and the pressure is taking its toll.
I am worried we're the oldest continuous, culture in the world, and I think that's very sacred and it needs to be protected.
Western Australia has managed to avoid COVID outbreaks seen along the east coast, and some there believe complacency is behind the poor vaccination coverage there. Lorraine Anderson is the Medical Director of the Kimberley Aboriginal Medical Services, and she joins us now from Broome. Dr Anderson, we spoke with you a few months ago. The COVID situation across the country has changed quite a bit since then. There are some jurisdictions that are opening borders and loosening restrictions regardless of the vaccination rate among Aboriginal and Torres Strait Islander communities. How do you feel about that?
Yeah, look, we're very concerned about that. Certainly, so here in WA, we've got, I think the latest count was about 55.2% of the population of WA are vaccinated. And of that 55.2%, only 21.66% of our Aboriginal population are vaccinated in WA. Now that's going up. Okay, so we are. It is improving, but we can't survive a COVID outbreak with such a low percentage of vaccination. And so we just want some more time to be able to take the time that it's taking to get people across the line in terms of getting vaccinated.
So how much more time would be needed to get those vaccination rates up? I mean, that isolation can't realistically be extended for much longer, can it?
The modelling that's been done for us would indicate that if we've got a few more months, we'll have a much higher percentage of people vaccinated. And so, just to give an idea of what we're doing with that time is that, we're dealing with a population of people that are very hesitant, and they're very hesitant for a lot of reasons. And one of those reasons is actually just a fundamental lack of trust. For historical reasons, there is a lack of trust from the Aboriginal community towards the government, and so breaking that down and talking about that really requires a one-on-one conversation. It's not something that can be done with a TV ad. It's not something that can be done by flying in the army to vaccinate everybody in a community.
We've heard about misinformation. Is that part of the equation for you as well?
Oh, absolutely. So there's a lot of misinformation still out there, and we actually have communications teams across the state that are trying to keep up with that misinformation and get the truth out there. And we're also engaging with different groups that are spreading the misinformation. We're actually engaging with them directly now. So again, I wouldn't say that we're on top of the misinformation, but we're definitely doing a lot better than what we were 3 or 6 months ago.
Dr Lorraine Anderson, thank you so much for joining us.
Thanks for having me.
Bridget, that misinformation campaign is really one of the key platforms in getting those vaccination numbers up, isn't it?
It really is, Jeremy. And I think what Lorraine was saying there is really interesting about those layers of hesitancy. There's a lot of different reasons why some of our mob haven't been vaccinated, and there were supply issues at the beginning of the vaccination rollout. There were issues over some misinformation around AstraZeneca. And then, of course, what Lorraine was referencing there, just deep historical mistrust in the government, that now Indigenous health services are working really hard to build that trust with people to get vaccinated, because of course they did an amazing job at the beginning of the pandemic in keeping COVID out of our communities.
When you break down the figures of who's vaccinated, elders in many communities are among the most vaccinated, which is encouraging, I suppose.
It's terrific news, especially in places like Victoria, the ACT and New South Wales, where case numbers have been really high. We do know that around about 85%, according to NACCHO, of elders have already been fully vaccinated. So that gives a really welcome level of protection. But then, of course, there are members of the community, even younger people. There are a lot of people living with a disability within the Indigenous community. There are children that have chronic health conditions as well. So actually, in fact, fact, all of the Indigenous population is exposed, and it's why I think we're hearing some real concern about plans not only for state borders to open up, but for international visitors to start arriving in Australia as well.
Bridget, so good to have you on this edition of The Vaccine. Thank you. And that is the show for this week. Bye for now.